This is Agriculture Today, and I'm Shelby Varner with the K-State Radio Network. The show starts with K-State Extension beef veterinarian A.J. Tarpoff as he lists his recommendations for what cattle producers should consider for vaccinating their livestock. A.J. continues the show as he discusses proper care of vaccinations, syringes and needles, and common mistakes producers might be making. K-State dairy specialist Mike Brouk ends the show explaining how dairy farmers can add a vital revenue stream to their operation using beef-on-dairy genetics to transform low-value dairy bull calves into high-value beef. That and more is coming up ahead on Agriculture Today. You're tuned in to Agriculture Today, and we start our Tuesday show discussing vaccination for cattle and proper care of those vaccinations with K-State Extension beef veterinarian A.J. Tarpoff. A.J., thanks for joining us today.
Always a pleasure to be on.
A.J., for this time of year for spring calving cattle herds, what vaccination things might they be thinking through?
Right. So right now is an interesting time. This is for spring calving operations. We're in the preparation mode, going to grass. We might be doing some things like working cattle, working the cows, working the calves, identifying the animals, doing all of those different things, preparing these animals to go out to summer pasture. When it pertains to directly when we start talking about vaccines, well, there's a lot of options on the market, and sometimes those options can be a little bit confusing for our producers to start making some of those decisions. So I think first and foremost, and I'll reiterate this later, but the value of the veterinary client-patient relationship and having your local veterinarian understand your operation, your goals, your history, any concerns that might be there with certain diseases, having them as a part of that conversation, as a key ally and guide through this process, I can't understate how important that it is. So again, work with your local veterinarian, but there are some generalities I think that it's important to understand. For these young calves, we consider it branding time, right? 2 to 4 months of age. This is the first ideal opportunity to start to interact with the immune system to start to boost protection against certain things. We have viruses and we have bacteria that these cattle are going to see within the environment. They're very common in cattle herds. They're common that get circulated around from a number of different ways, or they just live in the soil. So these animals will see some of these issues, if not soon, later in life. Now, those viruses, they're pretty consistent. We have a handful of viruses that are of usually the utmost concern in the cattle industry. And those are IBR, infectious bovine rhinotracheitis. We just call it IBR. It's a herpes virus. It's commonly out there. It spreads through groups of animals like wildfire. So we consider it, it very likely they're going to interact with IBR. Similar with BVD, so bovine viral diarrhea virus. Both of those can wreak havoc on the breeding herd. They can also wreak havoc on our young calves, which is kind of what we're focusing on now. Now, thankfully, a lot of the products that are available, they are multivalent. So we have numerous different type of virus protection in one injectable product or one nasal, something along those lines. So we do need to be cognizant that we want to include IBR, BVD, and usually they include a couple other ones, so we don't see quite as often, but they're BRSV and PI3. So usually we call it a 5-way. It's a multivalent 5-way viral. We have killed, we have modified live. Again, that goes back to the conversation with your veterinarian on what should be used in your particular operation, but we want to include those pathogens. The other one, the bacteria, well, the common ones, the ones that are in the environment themselves. So we think about clostridials. So clostridial vaccines, they live in the soil for long periods of time. We consider them ubiquitous. They're everywhere in the environment. We want to make sure that we start to boost some of those protection for those young animals. And a lot of times producers refer to these vaccines as the black leg, right? Everybody gets a black leg. Well, blackleg is only one piece of that 7-way or 8-way or 9-way. But again, we do want to have protection within our herds. We want to protect these young calves early. So we're probably going to include some of those clostridials. The other bacteria that we can include, usually we wait till a little bit closer to weaning, but sometimes they're included, can be things like the respiratory bacteria. Sometimes operators choose to use things against pink eye. Again, those are kind of optional at this young age, but at least starting the animal off with some of the protection from the viruses and some of the protection from the clostridials to get those young calves off to a good start.
And for those young calves, if they're working on castrating some of those bulls, what are some different options they have for getting that done?
Yeah, so I guess first and foremost, branding time, first time that a lot of operators are handling those calves for the first time, that may change how we vaccinate animals as well. Keep in mind that if we have any type of wound, that opens up an opportunity for tetanus. So whether it's castration, whether it's dehorning, doesn't matter what mechanism you use, because there's some type of wound, there can be an opportunity for that bacteria to enter and start to thrive. That's where we want to make sure, and we're working with your veterinarian, if you're doing those practices, making sure that we're including tetanus into that initial vaccine scheme. So when it comes to castration, it gets pretty technical when it comes to castration. As long as you can count to 2, I have faith that folks can castrate their animals. We have bands, we have surgical, we can do different things for hemostasis or making sure that they don't bleed. But it comes down to consistency, comfort, and making sure that you can do it the right way every single time very consistently. So counting to 2, and then whatever method, making sure that if you have questions, asking your local veterinarian for proper training, asking for tips or tidbits. There's not a right or wrong method as long as we're doing it appropriately.
And while we're thinking about vaccines, are there ever too many vaccines that can be given to a calf?
Potentially. So that's one thing to keep in mind, that these are young calves. Their immune system is still developing, that if they're very young, we might have some interaction with the maternal antibody from colostrum. We've been finding with a lot of our newer vaccines that we're still getting reliable results of stimulating the immune system down to about a month of age. So if they're 30 days of age or older, we can feel pretty confident with most of the injectable products that we're going to get some type of response so we can boost her later. So how much is too much? We can stack too many of those vaccines on top of each other, and we call it endotoxin load. So all products we utilize, a lot of them as a part of the manufacturing process, we have a little bit of endotoxin that's associated with some of those vaccines. If we give too many products at once, the immune system has to respond. It's a challenge to all those different antigens. So if we overload the immune system, probably not going to get as good a response as we could have. Number 2, we try to be cognizant that if there's too many products at the same time, we can overload the animal with a little bit of endotoxin where they really feel dopey. We see some of those things, and their immune system doesn't get the full response and protection that it could have. So again, we don't want to give a little baby too many different things all at once. We want to make sure that these critters are responding appropriately.
Have you ever seen a calf have an allergic reaction to the vaccinations?
So yes, that's called anaphylaxis. So anaphylaxis absolutely can occur because when we think about the numbers of animals that we're vaccinating and the number of products that we're utilizing, just given the percentage chance, a lot of producers are going to see some type of anaphylaxis at some point in time within their career. So again, being prepared, being proactive, working with your veterinarian. We do have an antidote, that we can administer quickly while we're vaccinating those animals in the branding pen. If we start to see some of the reactions, the animal can start foaming and dripping out of the breath. They can breathe really fast and they can kind of collapse. So it's a true anaphylaxis. What people think about with like a bee sting, right? We need to be prepared for that. So there are some prescription medications we can keep on hand to make sure that we can properly treat that animal if necessary. It's epinephrine, maybe a little bit of steroid on top of that to make sure that we can get those animals over that anaphylactic issue. So again, being prepared, because if you're stuck if you're an hour away from the local vet clinic and they start to go into anaphylaxis, we can't save that animal. So being aware, understanding what to look for, always keeping an eye out into the holding pen of animals that you've already worked to make sure that they're not having some of those reactions.
And you mentioned a tetanus shot when we're thinking about dehorning, but are there any other special considerations that producers should keep in mind?
So cleanliness and care of all the equipment, making sure all the equipment is utilized appropriately, understanding that there are differences in tetanus vaccination versus antitoxin. So when we vaccinate, that's a challenge to the immune system to respond and build protection. So that is a toxoid. So whenever those products, that's a tetanus toxoid product. Differently, there's also some products that are on the market called a tetanus antitoxin. That's a preformed antibody that has a short-acting activity in the body. Usually we use that for tetanus treatment and some things like that. There are some scenarios where your local veterinarian may want you to use some of it or maybe use both products simultaneously just because the risk is so high in the given region. So again, very local. I always, kind of defer to the local expertise because those veterinarians understand the risk much better than what I can provide today.
That was K-State Extension Beef Veterinarian AJ Tarpoff discussing vaccinations for cattle producers to consider when they're getting ready for summer turnout. If you'd like to hear more on this topic, you can stick around today on Agriculture Today, as AJ will be joining us in our next segment to continue this conversation and discuss vaccine, syringe, and needle care. You can also find more information by going to ksubeef.org. We're cutting to a short break now on Agriculture Today, but stick around because we'll have more for you up ahead. You're tuned back into Agriculture Today, and we continue our show and conversation with K-State Extension Beef Veterinarian AJ Tarpoff. In the previous segment, we were talking about vaccinations for turnout for cattle coming up. However, while we're thinking about all this, important to also consider vaccine, syringe, needle care. And so, AJ, when we're thinking about all these, what's the most common mistake you see producers accidentally making?
Yeah, vaccine care is critical. The quality control of today's manufacturing is second to none. It's absolutely amazing that the quality control from manufacture through transportation until all the way to sale, that's very close guarded to make sure that we have proper temperature control. So I think one of the biggest issues that I see out in the field is temperature control from purchase to use in the pasture. So making sure if you purchase it online and it gets drop shipped to you, well, making sure it shows up on ice packs, making sure that it gets transported from the cooler into your storage, refrigerator, whatever that might look like on your operation, making sure it gets transferred really quick, making sure it shows up and those ice packs are still intact, making sure it's still at the right temperature on arrival. Or if you purchase from your local vet clinic, transportation from the vet clinic back home, that kind of needs to be a direct path, even though you're carrying it in a cooler, you have an ice pack, making sure that sometimes we get sidetracked. We all do. So we might not go straight home to go put that stuff in storage. So making sure all of those things, you're cognizant, you're thinking about it, that it's kind of a ticking time clock, that we only have so much time in transport before we need to get that to a proper temperature. So proper temperature, a lot of our products and vaccines have to be refrigerated. Refrigerated is not cold, it's not frozen, it's not hot. It is 35 to 45 degrees Fahrenheit. Making sure that your on-farm storage, whether that's a refrigerator out in the shop, a refrigerator in the breezeway, wherever that might be, making sure that refrigerator is actually keeping proper temperature. The only way to check that is actually to have a fridge thermometer to make sure that it's under proper storage temperature, that you can keep that quality control going all the way out, before you take it out into the pasture. Now, when you take it out in the pasture, making sure that we are transporting those products in a cooler, usually with some ice packs, not in direct contact. You can wrap some paper towels around them, keep them a little bit separate so they don't get too cold and freeze, but they also don't get warm. We're protecting those products from the sunlight, and we are protecting that all the way until we administer it. So we kept the quality control, we kept the consistency, the temperature control from purchase all the way to use into that animal.
when we're thinking about maybe pulling up those vaccinations, is it okay then to set the bottle maybe on the truck bed?
Well, preferably not. I guess first and foremost, if you're using these different products, we have ready-to-use products that are already mixed. They're in solution that you can draw straight into your syringe and then administer the animal. There are some products that you might have to rehydrate, where they come with two bottles in the box. One is, we call it a cake, but it's a dehydrated form of whatever product you're administering, and then some type of fluid that you have to rehydrate that cake. Now, if you do that, chances are a component of that vaccine is going to be a modified live. Now, that modified live, whether it's a modified live bacteria or virus, whatever that might be, it's fragile. Those products, once we reactivate them, we expect them to work in the body for a short period of time. Now, time is of the essence, quality care and temperature is also of the essence. We have to be very cautious with those fragile, live products. They're only good for about an hour after we mix them. So making sure that if you're working groups of cattle, that one, you're mixing the vaccine as you go. You don't mix everything up front. You only mix as needed throughout the entire day, and you're using what you can use within an hour. So if you can only work 20 head an hour, given the different constraints in gathering cattle and all of those things, well, you only try to mix small volumes as you go throughout the day to make sure it's staying viable. Back to your initial question, can we just put those mixed products or those bottles, on the tailgate? Preferably not. Those go back into the cooler. Again, we want to make sure we maintain that temperature all the way until it enters that animal. That's a part of the last part of the quality control. I think lastly is drawing up some of those syringe and basic syringe care, maybe needles care, is also very important to consider. So needles. First and foremost, we talked about drawing up vaccines. We never put a dirty needle that's been in an animal back into any type of pharmaceutical bottle. We always want to put a new needle into that before we pull up anything in a vial, because we don't want to cross-contaminate or potentially put bacteria from the skin or the hair back into a bottle and cause that contamination. That's kind of needle care, one for going into the bottle. Syringes themselves, we need to be cautious to make sure that we keep them clean. So cleanliness of reusable syringes. A lot of the multi-dose, we might have 20-dose vials and things like that we can refill an entire syringe. Years ago, we used to scrub those things out with disinfectants. We don't recommend that anymore. Near boiling water, where we will pull those into those reusable syringes multiple times to clean out any residue on the inside. But what we've learned is, especially with modified live products, they're so fragile that any residue from disinfectants or soap or anything like that on the inside of those syringes can permanently damage or even destroy some of those live particles. So hot water kind of does the best. We don't use lubrication on those O-rings or anything anymore. We just replace the O-rings. So the manufacturer and the care of those products have changed over the years. So the individual single-use, small syringes, those are not reusable. So cleaning those or trying to disinfect those really doesn't work. Those are a one-time use, and then they go in the trash. As for sharps, it's always a good idea to have a sharps container to make sure that we don't inadvertently stick ourselves or anybody else that's working, that once you change those needles or refill a syringe or you give and administer something, to dispose of those needles in a safe way in a sharps container that's hard-sided so they don't stick through, nothing like a grocery bag or anything like that. And then changing needle on the animals. So we got to keep in mind that these needles are not indefinite use, that they do have a life expectancy, that if you're working calves, the basic recommendation is every time you refill your syringe, you're using a new needle, or at minimum every 10 to 15 head. So 10 to 15 head, change the needle, swap that needle out. If you have any concern for bloodborne transmission of any diseases, that can be anaplasmosis, bovine leukemia virus, Tyleria that's going around. We're actually changing out those needles between each animal, just to make sure that we are not inadvertently transmitting some of these diseases by the tip of the needle. So those are some basic tips of quality care to make sure that we're getting the most out of these investments in our animals.
For people who are reusing those syringes and have cleaned them out, should they then be labeling them if we have concerns about modified live vaccines?
Absolutely. So that's another great concept is we actually mark the kind of either the barrel of the syringe, the knob on the back end. You can paint them different colors for various products that you might be utilizing. I know commonly the black knob gets used for black leg because we don't want to cross-contaminate or mix products inadvertently. So we want to be consistent with what products we use in what syringe. That's where we can use the black for black leg. We can use a red knob for another term for IBR is red nose. So we can use a red knob for the viral one that has red nose in it. So there's other ways. Everybody has their own way to distinguish certain syringes for certain products. But it is great to identify them, whether you use tape, a little bit of a magic marker where you can draw it out, color, whatever works for you. It's just good practice to make sure that we have separation, that those products that get used in their allotted syringe throughout that entire process.
So as we've been talking about this and thinking about this, what are your key reminders for cattle producers?
So key reminders, number one, contact your veterinarian. Prior to making any of those purchases, making sure this coincides with your herd health plan. So not only vaccines, but any other product use, whether it comes to deworming, if you're going to utilize anything like growth promotants, if you're going to utilize anything. I think it starts with the conversation with your veterinarian so you can track progress over the years and over time, and it coincides with what your ultimate goals are. And number two is quality care. Whatever product that you purchase, whatever you utilize, making sure you're following label directions for quality control, which if it's refrigerated, remember 35 to 45 degrees Fahrenheit, maintain that cold standard all the way through the process. And then we can't forget about administration and care all the way chute side. So keeping coolers, making sure we're protecting those products from the sun, we're changing needles appropriately. And if we're giving injections, anything that goes inside the animal, either subcutaneous or IM, following those label instructions from the manufacturer, but we're administering those products in the triangle of the neck. So that's basic beef quality assurance guidelines. Below the nuchal ligament, in front of the point of the shoulder, and above the spine is our injection site location for all cattle in all classes. Again, read that label. Some of our products aren't injectable anymore. They might be intranasal, where we squirt them up the nose. We don't want to misinterpret what those products or where those products are supposed to go. We want to make sure they get into the animal as they were designed.
AJ, I appreciate you taking the time to join us today.
Thank you very much, and good luck preparing these critters for grass.
That was K-State Extension Beef Veterinarian AJ Tarpoff. We're cutting to a short break now, but we'll be right back.
Welcome back, and thanks for joining us on Agriculture Today. Along with Shelby Varner, I'm Jeff Wickman. We end today's program with this week's milk lines. Beef on dairy genetics are critical for transforming low-value dairy bull calves into high-value beef. It's estimated that beef on dairy calves can add as much as $5 a hundredweight to the overall operating income on the dairy. K-State dairy specialist Mike Brouk says that selecting superior beef sires, especially Angus, improves carcass quality and feed efficiency, creating a vital revenue stream while ensuring better marketability and improved carcass consistency.
Today I'd like to visit with our Kansas dairy producers about trying to get more money into the checking account on your dairy. As you think about your opportunities, I know many of you are thinking about how you can get more of those cross calves, the beef on dairy calves, into the system. And, when we look at the overall impact of those on our dairy operations, I think many of you will find that they may be adding about $5 a hundredweight to the overall operating income on your dairy. So they are important in trying to reach a higher level of income on your dairy. However, this game is changing. In the past few years, just having a calf that had a black hide seemed to bring a premium in the market, but things are changing. We're seeing some things that are going to involve genetics as we go down this road, and that's how we're going to get prime prices for these beef on dairy calves. And there's a reason for that. When we switch from the milk business to the meat business, we need to be concerned about carcass quality and also consistency in those carcasses. And the dairy beef cross are generally very consistent, but we can actually do better. Genetics are going to be part of this. And what am I meaning about this, and why do we look at this? Well, if you look at the average fed cattle harvest across the United States, roughly about 12% of those animals harvested would be prime and about 73% choice. However, if you look at program-specific dairy beef animals, we might be hitting as much as 40% prime and only 59% choice. So genetics are important. And it is important to be involved with a program that is recognized by reducing the amount of variability that we might see in our carcasses. So the type of genetic material that we decide to use for these dairy beef animals is going to be very important. As we look at some recent market data, there has been feeder calves selling at about 450 pounds. We see that those that are coming out of a verified genetic program actually brought almost $53 a head more than those that were not. So calves with no genetic program in the future may actually be worth less, even on the dairy beef side. So if you're not working with a semen supplier that's supplying you with semen that is from a verified program and matches the genetics of the animals that you have in your herd, it might be important to consider looking at this and making changes so that you do have verified programs, verified genetics that back up the calves that you're trying to produce. And as we look into the future, this is going to get more complicated because we're likely to see changes in how we evaluate the genetics that we utilize, focusing more on hot carcass weight as well as ribeye distribution. The reason that this is going to probably become important is because we're trying to hit some specific specs that are part of programs like Certified Angus Beef. So the next chapter, as you think about genetics in your dairy herd, it's not just about the genetics on the dairy side, it's also the genetics about what we're going to use for our dairy beef cross calves. So focus on programs that are backed by data that has resulted in premiums, making sure that they match the genetics that you already have in your herd as far as the dams that are going to be involved. So it's not just about the beef sire you're choosing, it's also choosing the right beef sire for the dams that you have in your herd. This is Mike Brouk with K-State Research and Extension.
Thanks, Mike. And that'll do it for this edition of Agriculture Today. For Shelby Varner, I'm Jeff Wickman. This is the K-State Radio Network.